Welcome to Focus Radio and Television. I'm Anthony Rayo, and this is Focus Lake County's radio program brought to you by Red Apples Media. Now on stands is our April issue that you can read about. The answer to the question, can Lake County coexist on a religious and a spiritual level? Plus, we're going to tackle the issue of public invocations, what's being practiced in our county. If you go to FocusLakeCounty.com, you can check out this month's Focus TV segment that also includes a rundown of these stories and more, and other highlights from the April issue, as well as a piece showing what Project Legacy is doing in their community for local youth. Plus, you're going to be able to see this radio program that we're hosting today and other Focus TV segments on LSTV, which is Comcast Channel 13, Bright House Channel 498, and Florida Cable 4, or online at LakeCenterTV.com and FocusLakeCounty.com. You can listen to us here on WLBE, My 790 AM, the first and third Thursday of each month here. And this afternoon, we'd like to welcome Tri-County Podiatry, Dr. Daniel Wassel. How are you doing, Dr. Wassel?
Doing well. Thanks for having me.
So you're welcome, and we're going to be talking to you today about feet and all that there is to do about podiatry. The first thing I wanted to ask you, though, is about your background, and you're newer to the practice. You're the newest of the 4 doctors that you have there at Tri-County Podiatry. Mm-hmm. What's it like being the new guy in town and kind of getting used to the different things that you maybe would have had in your previous practice?
Yeah, it's definitely a change. I came straight from residency to this practice, and it's been an adjustment. It's much different, obviously. I've moved here from California, so it's an entire ocean away.
Yeah, Florida to California.
Absolutely, but it's nice. It's a really good practice, good people there. Patients are awesome. I can't complain. It's a pretty good fit.
Now, you did your residency at Kaiser Foundation Hospital?
I did. Part of it in Albuquerque, New Mexico, at the VA there. I was there for 3 years, and then I did 1 year at Kaiser in Sacramento.
Oh, okay. And the School of Pediatric Medicine in the California there?
Yeah, in the Bay Area.
Very cool. So now your background, what has that helped you with since you've been here in the Villages area and in Lake County?
Well, it's nice growing up in the Midwest and spending some time on the West Coast for my podiatry school, and then in the Southwest for part of my residency. I've been able to meet people from all over the country, and it seems like the Villages especially, there's hardly anyone that's actually from Florida, so everyone's pretty much a melting pot of the rest of the country, so it's kind of nice to meet people from all over.
Yeah, and I understand that taking care of patients is really kind of your first priority, and that a patient will come to you, maybe they have a pain, it restricts their activity. How do you feel when you're able to help somebody get past that kind of issue?
It's a great feeling when the patients come in the first visit and they can't do their golfing or their bowling or pickleball in the Villages, if you will. They're just looking to get back to their daily activities or just walk without any pain throughout their day. And so it's kind of nice when you slowly see them progressing, getting better, and eventually, seeing them for the last time when they're completely better. It's a good feeling that you've actually made them better through your treatment.
Neat. Now, you've been kind of all over the country, so you've seen different foot problems in different areas. What's a unique problem that you've found here in Florida?
Well, in Florida, it's a different population. Our population's at least on the older end of the spectrum, so we get a lot of patients with weaker bones, so we'll see a lot of insufficiency type injuries, fractures, things like that you might not see in an otherwise elderly population.
Yeah, I was looking at ingrown nails. Like if you get an ingrown nail, when should I come and see a doctor? Should I try to take care of this myself? I know a lot of people do that.
Yeah, some people will try and trim it. They'll do soaks at home. It's best to come in before it gets extremely infected, because at that point there's not a whole lot of things that we can do at that time as far as permanent solutions to it. We just kind of try and get the infection under control, and then if it becomes an issue, there's things that we can do to address it in the future.
Yeah, what are some of the treatment options for something like that?
So a lot of times I always talk to them, just trimming it, cutting the side out, and if that gives them enough relief, great, then they can keep going. If it comes back again, sometimes you have to take out the entire side of the nail if it's digging in all the way along there. And then that usually will take care of it. And sometimes if it's really resilient and it keeps coming back over and over, there's a chemical we put in there that prevents it from regrowing on the side there. So takes care of it for the most part. It's about 90 to 95% success. I always let people know that there's always a small chance a little piece could grow back, but usually it doesn't.
Wow. What is the downtime on something like that?
It's really not too much. The first day I tell them after we put the dressing on, take it easy, don't do anything too out of the ordinary, don't go for a run or anything like that. After the first day, do your soak, and then smaller bandage after the first one. You could go golfing a couple days later if it's not hurting you too much. But usually the pain's much better than when they came in. So
yeah, I was wondering about the pain because I know the pain when you go in and you just got an ingrown nail is just unbearable.
And that's the most it'll typically be. The injections are a little uncomfortable, but sometimes that's needed when it is as painful. You can't really get it out as well unless you numb up the toe. After that, they really don't have too many issues.
Oh, that's neat. What were you going to say?
Most people are surprised when they come back the next week at how little it actually hurt. They kind of had heard from people that I'm going to be down for a week or two, and it's really painful. It's really not too uncomfortable for them, and they're usually back at their regular activities in a couple days.
Yeah, the foot doctor isn't always the top priority on everybody's list, but when you have problems with your feet, why do you think it's important for people to take the time out of their schedule to make sure that they get things like an ingrown nail or maybe tendonitis or flat foot, that kind of pain in their feet looked at?
Yeah, I mean, it's always good to have it looked at by someone that does it on a regular basis. If you have pain that's really not going away, and other places may have told them, hey, it may just be a tendonitis or things like that. It's always good to get an x-ray, make sure nothing's broken, make sure there's nothing else going on that they might not be aware of, especially if they're diabetics. It's always good to get them in at least once a year, make sure there's no changes that can lead to infections and things of that nature.
Yeah, and that seems to be important. I was just thinking about like fractures, like a stress fracture, that can be something that leads into an arthritic pain in the future. So what would be a good way to avoid, and what should somebody do if they fear maybe I've had a stress fracture, maybe I've had something that's gone on that needs to be looked at? What's the steps that they need to take?
So if someone feels as though there's a pain in their foot that's not going away, it's kind of there every time they walk on it, it's always a good idea to get it x-rayed, see what's going on. A lot of times they don't necessarily show up on x-ray, but clinically you're pushing around on it, you can kind of tell that there might be some type of stress fracture going on. It's always good to get it in sooner, because the longer you wait, and if it is one and you keep pushing it, it's going to continue to get worse. Yeah. And it takes longer for it to heal.
What are the most common types of stress fractures?
Usually overuse. If someone takes on a new workout routine, they start increasing their mileage if they're a walker or runner. It's usually that repeated stress through the bones that usually cause. Second and third metatarsal is the most common. Fifth metatarsal usually we see from inversion sprains. Sometimes that'll pull a little piece off the end, but typically stress fractures are from overuse or from bones that just are a little osteopenic or a little more brittle as we get older.
Yeah, I was just going to ask what that meant, osteopenic. That's brittle, so like...
Osteoporosis.
Osteoporosis leads in. Okay. So what can I do to help, like, if I have a fracture? Say I go to the doctor now, what would be your advice to me if I had a fracture?
Probably put you in either a boot or a post-op shoe, depending on what kind of fracture it was and your ambulatory status, how well you get around. Limit the activities. A lot of people, they'll try and do it. You go to the driving range, you'll see someone in a boot, probably run around there. It's probably best to kind of take it easy. Just go to wherever you need to go, get your mail, grocery store. Outside of that, activities like pickleball, golf, things like that aren't going to do any favors as far as getting the fracture healed any quicker, and it's just going to prolong the amount of time that you're in the boot. So it's better to just take it easy and let the fracture heal.
Yeah, and if you're not careful, it can lead to problems like arthritis.
Mm-hmm.
So what are some symptoms that you could maybe look at to say, oh, maybe I have arthritis here in my foot or something like that?
Yeah, anyone that's had a previous injury of a joint or things like that, they're more prone to arthritis. Increased swelling, any pain with motion of that joint, like your ankle, every time it moves up and down. Your big toe joint's another common one where we see arthritis. Anytime someone pushes off, right as soon as their foot leaves the ground, they kind of get a sharp pain. That's more of the bone rubbing on the bone from the cartilage wearing out. That should be something they should get checked out if it's bothering them.
Now, what are some of the treatment options for arthritis?
Arthritis, it kind of depends on where it's at. Injections can sometimes help. Sometimes bracing them to limit how much it moves can help with the arthritic pains. Eventually, depending on what joint it is, some joints can be replaced with different implants. Some joints need to be fused by putting either plates, screws, whatever it takes to put the bones together, prevent the motion that eliminates the pain.
Okay, so that's interesting. So it all kind of leads into one another thing, you know, like fractures can lead into problems.
Arthritis.
So what would you tell people in order to motivate them to make sure that they're taking care of their feet?
I'd probably say if you have anything that's limiting the activities that you typically can do, if they're having any pains that aren't normal for just daily aches and pains, then probably a good idea to come in and get it checked out sooner than later. Obviously, the longer you wait, the longer it takes, especially if it's a tendonitis, fasciitis, things like that. The quicker you get the diagnosis and treatment started, the quicker that everything starts healing.
And where could we go if we wanted to find out more information from you?
We have our website. You can search Tri-County Podiatry in the villages, and that'll get you to our website. Then you can get our number, call, make appointments through there.
Perfect, perfect. So I've always had a question. I don't know if we have enough time before the break, but I'm going to ask it right now. Flip-flops, are they good? Are they bad? It seems like every podiatrist I've ever met does not like flip-flops. Why is that, and why should people either avoid flip-flops or get the right kind?
That's a good question. Obviously, living in Florida, everyone loves to wear flip-flops. It's impossible to convince people that you shouldn't be wearing flip-flops. And the reason flip-flops in general just don't offer support to the foot, especially if you have a flat foot, high arch, there's not really anything that helps to stabilize the foot, so you're more at risk for sprains, fracturing. All those things are at higher risk by wearing sandals versus a good supportive shoe. There's newer sandals coming out on the market that have arches built into them. They can help, especially with heel pain and things of that nature, by having a good supportive shoe or sandal that helps to stabilize the foot. But in general, flat sandals, flip-flops if you will, they're nice to have at the beach because you're not collecting all the sand that a shoe does. But in general, a good supportive shoe is best if you're doing a lot of walking. Flip-flops around the beach pool is probably okay just for their utility, but on a general basis, going for long walks, it's not a good idea for your feet.
Yeah, an everyday thing might not be a great idea. Well, that takes us right into our first break. Thank you, Dr. Wassel. And when we come back, we'll be talking more about feet and podiatry with Dr. Daniel Wassel. You're listening to Focus Lake County Radio. We'll be right back. Welcome back to Focus Radio and Television. You're either listening to us here on WLBE 790, my 790 AM, or you could be watching us on Comcast 13, Bright House Channel 498, or Florida Cable 4. And today we've been talking with Dr. Daniel Wassel of Tri-County Podiatry in the Villages. And we have a lot more to talk about. Before the break, we were talking about fractures, arthritis, things like ingrown nails, and how you can treat those things, what your options are, and what some of the common problems with feet might be. We even talked a little bit about flip-flops and how interesting that is, maybe avoiding flip-flops, you know, if they're just flat ones, but making sure we have a really supportive shoe that we're wearing so that we don't lead to any more problems with our feet. Now, another question I had, this has, I guess, to do with tendonitis and flat-footedness. What is tendonitis exactly?
I always tell everyone that anything that ends in an itis, it involves an inflammatory process. That's kind of where the root of that part of the word comes from. So a tendonitis is just a tendon that's become inflamed either from overuse or from a particular incident where it was strained, like running activity. You can really kind of strain a tendon and it becomes inflamed. So you can develop tendonitis from either, like the stress fracture, either overuse on a chronic basis or just one particular incident where you twist it or something and you can have some tendonitis from that.
Now, what are some of the treatment options when you have tendonitis?
So for tendonitis, a lot of times anything that is inflamed, resting it helps. Gentle stretching is also good. I always recommend to patients with a lot of things. Stretching exercises are always good, especially any kind of tendonitis. And also anti-inflammatories can help, either if it's in a localized area that can be injected. If it's a long tendon like an Achilles tendon, they don't really lend themselves well to injections because they make it more prone to like a rupture. But in general, plantar fasciitis, things like that, other types of things can sometimes be alleviated by injections, or mostly just resting it, not doing the activities that really make it worse if you're doing any sports and things like that that are aggravating it.
Right. Now, what causes something like flat foot? Where would I get that from? Can I catch that?
You can't. Well, if you were a woman and you got pregnant, sometimes with the hormones involved in the pregnancy, it can cause the tendon ligaments and things to become more elastic and stretch out. And so that's why women say sometimes that ever since my pregnancy, my feet have flattened out. It's just they've kind of stretched. Some people are born. It's not just a gender-related issue. You know, male and female is probably about equal as far as flat feet. Genetics, you know, patients will come in, my dad had flat feet, my grandpa had flat feet, and obviously they have inherited that trait from their parents, and so it's always good to kind of evaluate. Sometimes flat feet can be a result of some neurological issues. Some of the nerves get damaged. You get some weakening of some of the tendons, and they can kind of flatten out. Your posterior tibial tendon is the biggest one that supports your arch. If that becomes weak, it can flatten out. You can develop a flat foot over time. Some people are born with it, so you'll see kids with very, very flat feet. Some flatness to an extent is normal in little kids, but as they grow up, by about the age of 7, they should start to develop somewhat of an arch. And then after a while, it just kind of depends. Flat feet, I tell people, aren't really abnormal unless they're painful. Right. So if it gets to a point where they're really flat, they're hurting them every time they walk, then that comes to a point where it probably needs to be looked at.
And that could, I guess, flat foot or even tendonitis could lead to like heel pain. Mm-hmm. And what are some of the other causes of heel pain, though?
One of the most obvious ones are poor shoes. People wearing sandals around a lot, hardwood floors, things like that can make heel pain worse. Heel pain can happen to anyone at any time. It's pretty common. I know most people probably know someone that has had plantar fasciitis at one time in their life or have experienced it themselves. It's just a stretching of that elastic band on the bottom of the foot, and it's made worse by wearing poor shoe gear, going barefoot, continuing to do repeated activities that kind of make it worse. It's usually the most painful at the beginning of the day or after sitting in a chair for a long time. Getting up, first few steps, people say it really hurts. Then as soon as they walk, it stretches out, it gets better. So that's why we recommend stretching. That activity can kind of get the ligaments limbered up, and that usually helps with the pain.
Right. So I guess a weight-bearing x-ray might be important to find out where the heel pain is actually coming from then?
Exactly. You want a weight-bearing one just to see the structure of the foot. If no one's putting pressure on the foot when you're looking at the x-ray, it's hard to tell whether it's due to a structural deformity, if they have a high arch, a flat arch. Unless they're putting weight on it, every foot kind of looks like it's a regular arch unless you put the pressure down on it, and then you're able to tell a little bit better. Make sure there's no fractures in the area. Sometimes you can get stress fractures of the heel, and so that's a good thing to rule out. That's why we get x-rays. You know, a lot of people, you know, they know, yeah, I've had heel pain before. It's probably plantar fasciitis. So a good idea to get the x-ray to make sure.
Just in case.
There's nothing else. Sometimes arthritis, but arthritis usually presents a little bit differently as far as the way the pain comes on and things like that.
So if you've been told, say, that you've had a heel spur, is that what might be a cause for heel pain?
A lot of the literature is showing now that the spur itself, there's a lot of people with spurs without pain, and there's a lot of people with pain without spurs. There's no real correlation, and all the surgery literature shows that just cutting that inside of the tendon relieves the pain without taking out the spur. So a lot of people fixate sometimes on the fact that they have a bone spur, and it's not always the spur, it's the inflammation at that tendon site. The spur is kind of a secondary finding. I always tell people, just because you have a spur on x-ray, it's not going to go away. You do enough stretching, the pain will get better. Doesn't mean the spur needs to be taken out. Very, very rarely do spurs ever have to be resected. Sometimes in arthritis, they can rub on nerves and things like that, but heel spurs in general aren't usually the root of the cause. It's kind of a secondary thing that from all the inflammation.
Okay, so it might not be the cause of the pain, but it could be
secondary finding.
Secondary finding from that weight-bearing x-ray, you'll see a heel spur.
Mm-hmm. Yeah, it's pretty common. People with plantar fasciitis, they'll develop spurs sometimes.
That's very interesting. Now, what about bunions? What exactly is a bunion, and now how do I treat it?
Bunion deformity is one where your metatarsals, your first and your second one, your big toe, the metatarsals will kind of spread apart, and your big toe will kind of angle, and you'll have a big bump on the inside. I think everyone probably knows someone or a relative that has a bunion deformity, and it can become painful sometimes with rubbing in shoe gear. A lot of times if people wear the right shoes and they've had bunions their whole life, sometimes it never hurts them. It doesn't absolutely have to be addressed. You know, the fact that it's there, it just depends on, like anything else. If it's hurting them, you know, then that lends itself to, you know, inserts and things like that.
And what can you do to avoid getting bunions?
Bunions, you know, everyone always talks about high heel shoes. It's not, it's more of there's kind of a mix between genetics, people who've had parents that have had bunions, or just wearing poor shoe gear. That can also make it worse. It can it rubs on the foot the wrong way, and it can make it progress more rapidly.
Okay. And the last thing I had, as far as all this feet stuff go, that I was wondering about is hammer toes. What is a hammer toe, and what causes it?
So hammer toes are kind of the cousin to the bunion there. You get a little bit of imbalance of the tendons of usually second through the fifth toes, where they'll the flexor tendon will sometimes overpower the extensor tendons on top, and you'll get a contracture. They're either rigid or flexible. So if they're rigid, they don't really move very much. They can rub in shoes, especially if they're wearing a dress shoe. It rubs. They come in, they either have calluses, they have red spots. It's pretty irritating. So hammer toes, I always tell people, they're not uncommon, but if they get to a point where they're hurting, you've tried different shoes, then it might be time to think about getting them fixed.
Okay, so perfect. And again, the number we were saying was 259-1919 if we want more information about some of the services that are available there, and we can find you guys on the web. We just got to Google Tri-County Podiatry and go right to the website. So thank you so much, Dr. Wassel, for joining us today. We really appreciate the information and some of the stuff that you had to say about feet and podiatry, and it seems like you're very passionate about what you do.
Absolutely, yeah. Thank you for having me.
Yeah, we appreciate it. So that concludes the interview portion of our show. We have a couple other things we can mention. Also, Hometown Health this month features Tri-County Podiatry, and you can find out more and see what they're doing for their patients in April's episode. And don't forget to take a look at Focus's April issue, which is on stands now in more than 100 locations throughout the county. We're tackling a kind of a taboo subject on religion and spirituality, whether people in traditional faiths and proponents of more secular ideas can coexist this month. So it's something that, as a reader, it would be interesting to take a look at, see how residents and leaders in the community are viewing things like public invocations, what's being practiced in our counties. Also, our serial story, The Six Hands, is continuing with Chapter 2. The fictional character Michael Green is learning about the concept of the six hands. And if you're a writer or author who's interested, you can actually email us to find out about taking part in writing part of the story at anthony@redapplesmedia.com. And you can read the story if you online at focuslakecounty.com. We also focus on the issues this month. You know, we've been talking a lot about medicine and different practices. A doctor and a patient weigh in on how the Affordable Care Act is impacting medicine on a local level. And we take a look at things, whether or not people like that or don't like that. We have a doctor who's not really for it, and then a patient was very for it because it helped them in their life. Also, our anonymous foodie visits Orange Blossom Hills in the Villages to see how recent renovations have affected the longstanding country club, and our focus on home tips for decluttering with registered and licensed interior designer Leah D. Connor, as well as our focus on better living with Lori Essere, who's actually in the practice there, part of the practice at Tri-County Podiatry. It gives an insider's look at supplements, and Robert Chandler, the growth department's director in Lake County, focuses on what economic development means to Lake County and for residents of our county, as well as the focus flashback there at the end of the magazine talks about the highlights of the original post office in Leesburg and goes along with a vintage postcard. So be sure to check us out on Facebook, subscribe to us on YouTube, and look for us next month on April 30th, actually, at the end of the month, Alani Medical Spa. So I'm Anthony Rayo, and thanks for listening to Focus Radio.